Okay, hello everyone. Welcome to the Doctor Interested webinar series. Today we have a very exciting webinar in front of all of us. My name is Alda Muki. I'm the Executive Director of Doctor Interested, and I will be your MC for today. Before we get started, we do want everyone to engage fully, which is why we ask that if you are comfortable, please turn on your cameras. Please remain muted unless you have raised your hand to speak, and please stay engaged through the chat. Along with that, before we begin, we would like to acknowledge that this event is being organized in Mississauga, Ontario, which is situated on the traditional and treaty territories of the Mississaugas of the Credit First Nation. And as we gather here virtually today, we encourage all of you to reflect on the lands from which you are joining from and to recognize the enduring presence and contributions of Indigenous people across Turtle Island, now known as Canada, and the greater world. With that, we would also like to remind you that this webinar is part of our certificate stream program. By this, if you join 7 out of our 10 scheduled webinars, you will receive a certificate at the end just to add into your portfolio, LinkedIn, wherever you need it. The QR code is here. I know some people were joining this meeting just for the QR code, so if you need it, it's here. It should also be in the announcements channel for our Discord. Um, And without further ado, our speaker for today is Kate Tucker. She is a second-year medical student at the Northern Ontario School of Medicine. And prior to studying medicine, Kate completed a Bachelor of Philosophy in Interdisciplinary Leadership and a Master's of Applied Health Services Research at the University of New Brunswick. Her graduate research explored the experiences of older adults without primary care providers, and she worked closely with a palliative care research team. Kate greatly enjoys working with high school and undergraduate students with an interest in traditional and untraditional paths to medicine, and can often be found on an active outdoor adventure when she is not studying. Kate can also be reached by her email here. With that, I will hand it over to Kate to begin for today.
Thanks so much, everybody. So I'm super happy to be here. Nice to meet you. My name is Kate Tucker. Like Adil said, I'm a second-year medical student at the Northern Ontario School of Medicine in Sudbury, Ontario, but grew up in Newfoundland, and so want to recognize the lands that I grew up on, specifically the Mi'kmaq land in Newfoundland and the unceded land of the Anishinaabe in Northern Ontario, where I'm located. So I'm going to talk to you a little bit about different pathways to medical school, specifically talking about research and those pathways, because that's my experience, but we can get started. So we can go to the next slide, kind of give an overview. Okay, so as I said, today we're going to talk a little bit about different pathways to medicine. So I'm going to tell you about my personal pathway to medicine, which is slightly untraditional, but not too far from the typical course. I'm going to talk a fair bit about research prior to medicine, including like what an undergrad might look like if you want to go to medical school, why you might consider doing a master's or a PhD, and then other pathways to medicine. And then there'll be lots of time for questions, tips, conversations. So think about your questions and write them down or put them in the chat as we're going, and I'll answer them at the end. Okay, next slide, please. Awesome. So like I mentioned briefly at the beginning, I grew up in Newfoundland. So if you're not from Canada, that's like a pretty remote province in Canada, specifically in a small town called Corner Brook. There's about 20,000 people that live there. So I graduated high school in 2019. When I was in high school, I really thought that I was interested in medicine, but I don't have any family members in medicine or healthcare at all. And so I didn't have a ton of like mentors or people in my life that could kind of show me what a career would look like. So like lots of you are doing here today, I took advantage of different outreach programs and different things that were showing high school students what careers in healthcare and medicine could look like. So I attended a couple of different workshops, volunteered at my local hospital, and got to see like what it actually looks like to be in a hospital, to be treating patients. And that kind of solidified that this was something that I was interested in the long run. I also got exposure to what a pathway to medicine looked like. And so I'm going to share a bit of that with you today, but I feel that it's important as a medical student to talk about that because it made a big difference for me to hear about the pathways to medicine when I was in high school. So after I finished high school, I went straight to university. So I attended the University of New Brunswick. I did a Bachelor of Philosophy in Interdisciplinary Leadership as my first degree, which is a small program. It's very social justice based. So if you're looking at university programs or know a little bit about university programs so far, this aligns well with like arts and science degrees, where you do a combined like arts degree and then also like applied sciences in that realm. So you do a lot of like critical thinking, lots of like group work and also community work. So hands-on experience was something that was important to me. But then I also took a minor in health sciences. And so this is not necessarily a traditional pre-med undergrad. There were lots of people who did my program who went on to study medicine, but it wasn't the majority of people in my program. And so traditional paths or traditional like undergraduate degrees that people often do before medicine would include things like life sciences, health sciences, things like kinesiology, biology are pretty like typical pathways because you get exposed to some aspects of medicine prior to studying at medical school. But the advice that I was given and that I would really recommend that you think about when you're picking what undergrad degree you want to do is that you should do a degree that you're passionate about, that you know you're going to get good marks in, because medical school admissions are very competitive, as I'm sure you're all aware. And so you really need to have a competitive GPA. And so you should do a degree that you are going to be successful in, because they're going to teach you medicine when you get to medical school. So you don't need to start studying medicine in a health science degree prior to medicine if you don't want to. You absolutely can. And especially if you're trying to figure out what kind of path you want to go on, doing an undergrad in that type of program can be really helpful. But the advice that I was given was to do something that you're really passionate about and to do something that you know you're going to do well in. And so I knew that I love leadership type of things. I love community development and I love social justice work. And so I thought, if I'm going to commit the next 4 years to doing something, it's going to be that. And that's going to make me a better medical school applicant, but also a better doctor because I understand different parts of the world other than just like medical sciences. So that's what I did. I actually finished my undergraduate degree early. So typical undergrads are 4 years, and I completed mine in 3, which I'll talk about on the next slide as well for like what an undergrad can look like. But when I finished, I was only 20 years old. I wasn't really ready to apply to med school yet. I knew that I wanted to end, like that was my end goal. But I didn't feel like I had a strong application yet. And I wanted a little bit more life experience because once you get into medicine, like you're kind of in it forever. And so if you want to do other things first, we're going to talk about this later on as well. Now's a good time to do it before you're applying. So I stayed at the University of New Brunswick and did a master's in applied health services research. This was a thesis-based program, and so I was basically learning how to be a researcher at a master's level. I worked really closely with the nursing faculty, and nursing and medicine obviously like work very closely together. There's tons of people who do nursing before medicine. And so this was something that was interesting to me. I got a little bit more of a clinical perspective, but also like really understood how the healthcare system works. That's what health services research is basically like looking at how the healthcare system works. And so I got to work very closely like with family doctors, with palliative care physicians, that's people who look after people who are dying. I got to talk to lots of people about their experience in the healthcare system. And I think that this really allowed me to understand like what patients' perspectives were of like the doctor side of things. And so that was very cool. And it definitely was a major boost on my medical school application. And so when I applied in the last year of my master's program, I was lucky enough to receive 2 acceptances to Canadian medical schools. And I think that a large part of that was definitely because I had done the master's work and had like a more clinical perspective. And so then in 2024, I started at the Northern Ontario School of Medicine. So I'm now in my second year. I am on the Sudbury campus. So the Northern Ontario School of Medicine is a pretty small school. There's a Sudbury and a Thunder Bay campus, and they focus a lot on like rural and remote health, which is something that I'm really interested in, especially as someone like who grew up in a pretty small place. And that's where I see myself practicing. So I ultimately picked going to this school because it aligned with my goals for practice. But it's the same type of program, medical, like a doctor of medicine will go forward. Thank you. So I said that I did an undergrad and then a master's, and then now I'm in medical school. But the typical like required pathway to becoming a doctor is going to high school, and then you need an undergraduate degree to apply to Canadian and US medical schools. You can definitely apply like abroad. You can go to the UK, you can go to Australia sometimes. Without an undergrad degree. So you can apply right out of high school, and those programs are longer. But I'm going to specifically focus on Canadian med schools today because that's the experience that I know, and that parallels a lot of the US med schools as well. So in Canada and US schools, you need to have a high school diploma to apply for an undergraduate degree at a university. You need to do a 4-year or like 4-year equivalent undergraduate degree to apply to medical school in Canada. Some med schools will take you a little bit early. I think that there are 2 or 3 in Canada that you can apply to like following your second year of an undergraduate degree, but you need to still be enrolled in a 4-year undergrad degree program at that point to apply. And so sometimes they'll take you a little bit early, but that's not like the typical pathway. And then you start medical school. Medical school is like 4 years in most places. Some Canadian schools have 3-year programs where you go directly through the summer. And then once you finish medical school, you have the Doctor of Medicine degree. So you have like an MD, but you're not done yet. You still do residency and fellowship. And so that's kind of like solidifying your skills in the specialty that you're interested in. And then after your residency, so once you've become like an obstetrician gynecologist or a general surgeon or a family doctor, you can do more training in what's called a fellowship where you would become more specialized. So for example, if you're an obstetrician gynecologist, which is someone who like delivers babies and works a lot of like women's reproductive health, you could go into like a cancer fellowship of women's reproductive health would be an example of that. But it's not always this direct path where you just do high school, undergrad, med school, residency, fellowship, and then you're done. Most of the time, it's not actually. And so I'm going to talk about some of those things coming up next. So we can go to the next slide, please. Okay, so I'm going to talk a little bit about like the research path before we go in, but I'll touch on other options as well. So next slide, please. Okay, so lots of times people focus on having research experience before they go to medical school. You do not need to have research experience to get into a medical school in Canada, but it definitely helps. An overarching theme of this talk today is going to be that the more you have been exposed to prior to going to medical school, the easier it's going to be once you're in medical school and practicing as a doctor, just because you know the world better, but also the more likely it is that you're going to be accepted. So you need a pretty like beefed up CV, I would say, to apply and be accepted in medical school because they want people who are well-rounded and also knowledgeable. They want to show, you want to show them that you're curious. And one of the ways you can do that is through research. But there are other ways you can do that too. So I really recommend like getting super involved in extracurriculars that you're passionate about. And it's very much about like quality over quantity. So you don't need to be involved in 17 research projects, but if you've done 2 research projects and you know them super well and you can like you light up when you're talking about them, you're super passionate, that's what's going to stand out on your application. And that can start as early as undergrad. So if you are hoping to get into medical school right out of undergrad, which lots of people are, some of the ways that you can get research experience includes like extracurricular or professional experience. So you can work as a research assistant in summer research projects and labs. Oftentimes in undergrad programs, there'll be an option to do a self-study. So that's when you work like one-on-one with a prof or like a couple of students with a prof and you do some sort of like independent research project. So you're not necessarily helping out in their lab, but you're doing like a small scale study. And then there's also tons of volunteered and paid opportunities. And sometimes these aren't available until you're in like second year of your undergrad and above, just because profs who are hiring you typically want people with a little bit more experience. And so if you don't have prior research experience, that's okay. Just know that sometimes it doesn't happen until you're later in your undergrad. But there are tons of opportunities once you're in university to be able to do that. And I would recommend doing like some sort of research project in your undergrad if you can find a way to do it. One of the ways that you can integrate it into your degree is by choosing to do an undergraduate thesis. So I did not do an undergraduate thesis. I did do an equivalent project. So I had like a summative capstone project where we did a research project. But I don't have like a Bachelor of Science with honors, for example, which some people do have. And that indicates that they did research during their undergrad if they've got that honors distinction. So that would mean the student works with a prof, typically like in that prof's lab or like with the research that they're already doing. They do like a paper related to it. Sometimes they publish it, sometimes they don't. And they definitely do a presentation at the end where they talk about the research that they did and like what the impacts are. Most undergraduate programs like I said, take 4 to 5 years. So some programs, especially if you're doing an undergraduate thesis, ask that you do 5 years because there's a lot of content to cover in an undergraduate program. And sometimes 5 years is also the best option so that you can do well in school. So like I talked about, like you want to make sure that you've got a competitive GPA to apply to medical school. Sometimes that means taking 4 courses a semester instead of like the typical or suggested 5 courses a semester. And that is so okay if that's what's helping you do better. If you need more time to study things, if you know that you've got other things going on, like you've got life happening outside of school that's requiring you to like take a break, take the time that you need to understand what's happening in your undergrad, to do well in your undergrad, and to like explore your options. So some programs already are 5 year based, but sometimes it's also nice to take the full 5. Okay, we'll go to the next slide and talk about master's projects, please. So you do not need to have a master's to go to medical school. I've been asked this lots of times, like, oh, like, am I going to have to do a master's to go to medicine? And you absolutely don't. You do have to do an undergrad, but you don't have to do a master's degree to get into medical school. That being said, it definitely helps your application, and it also helps the skills that you already developed. There are lots of different options for master's programs. So I talked about doing a thesis-based program. So that's the second like point here on the slide. So a thesis-based program is research training. You're basically learning how to be a researcher, not to the same level as a PhD, which is what I'll talk about next, but you definitely are learning like how to be an active researcher, how to be involved in a study, maybe how to run a study. Maybe you'll get lots of conference experience, publications. All of those things are super great to have on your CV, not only applying to medical school, but also applying to residency when you're done medical school. So once you get into medicine, it's not just like everything's easy and you don't have to apply for things again. You still have to keep up your CV and keep working on things. And so already having a master's degree is a huge step up in that because you don't necessarily have to work to do so much research while you're in medicine. There are other options for masters before medical school that I don't know as much about, but I put on the slide because I think they're really important to consider. And that's like professional training designations. So things like physiotherapy and occupational therapy are also master's degree programs. As is like advanced practice nursing. There's different like psychology, counseling, social work options, also like public health and global health. And all of these things are super common for people to have studied before they come to med school. It is obviously nice if you're doing like the physio or like occupational therapy route to want to be an occupational therapist or a physiotherapist for a little while, at least before you go to medical school. I know some people that like did a master's of science in physiotherapy and then never ended up practicing as a physiotherapist because they went straight into medical school. And I think some of them are sometimes a little bit disappointed that they didn't get to practice right away. But being trained as another healthcare provider, either through a master's program or otherwise, definitely will never hurt you in medicine. You'll know the system well. You'll know how to treat patients differently than like just being a doctor. But these are like pretty common pathways that people take. And master's programs are typically like 1 to 3 years. Thesis-based programs are typically 2 years. Most of them are 2 years. Sometimes things like go a little bit longer in it, so it takes 3 years. But if you're doing like a course-based program, so that would be like the professional training or things like public health, global health, lots of them are just 1 year program. And so sometimes that also just buys you time to apply again to medical school or apply for the first time. We'll go to the next slide, please. Okay, so PhDs are what like your professors have to do to become a professor. And this is like very specialized training in research. This is like the professional training to learn how to be a researcher. And PhDs are 100% not required to go to medical school. That being said, again, it's not going to hurt. It is a huge time commitment. PhDs take between 4 and 7 years, and to work in a PhD program, you need to have an undergraduate degree and a master's degree. So you've already committed like at a minimum 6 years of school in university before even starting a PhD. It is not uncommon for people to do a PhD and then think that they want to do medical school. And we'll talk later about some options where you can do a combined like medical degree and PhD or medical degree and master's degree at the same time. But this is like super specific research training. You become an expert in one very specific field. And there are different career pathways. Definitely, most people, I would say, consider academia or industry or like working for government, so kind of industry as the main like things that you would do after a PhD. You can definitely go back and study medicine also. But a PhD is very specific, like research-based training. It definitely complements medicine well, especially if you want to be a clinical researcher, which I will talk about on another slide. But there are like tons of parallels between wanting to do research and also wanting to do medicine, and advantages of having both a medical background and a PhD to be able to understand research very well. If you don't do research before you go to med school, not the end of the world. Like I said, it's definitely a bonus to have on your application if that's something that you're interested in. But if you're interested in something else, like that's totally fine to do before medical school too. Just make sure that you're involved in stuff so that you've got things on your application. But at some point, they will want you to have some exposure to research if you're going to be a physician. I think that's just the way that it is, which makes sense because physicians rely so heavily on research. So you want to be able to understand how that research came to be so that you can interpret it correctly. If you haven't done any research, or if you just love research and want to stay involved in med school, there are tons of opportunities, kind of similar to undergrad. If you're in like a summer research project, you can do self-study projects. You can also do volunteered or paid opportunities. You do get summers off in med school between your first and second year and between your second and third year. And so there's time to like work a little bit or be involved in research projects. Some curriculums also require that you're involved in research. So at my school, when we're in third year, we have a required research project. Other schools have it earlier in the curriculum or whatnot. But it is important for residency applications, and especially more like quote unquote competitive specialties. So you're thinking like very specialized surgical specialties, places where if there's not a lot of like that type of doctor, then it's considered particularly competitive. And those types of residency applications, you would really want to have research to show that you're going to be like very academically minded as a clinician. Um, and then, like I said, there's also potential for academic research positions or like collaboration postgraduately. So they want you to have research experience, one, so that you can interpret it, but also like it's amazing to have an MD on a research project that's about some sort of clinical scenario. So instead of just having people with PhDs doing the research, if you've got a medical doctor who isn't necessarily trained in like research methods and those kinds of things, but understands like the patient side of it and the clinical correlations, that's a huge step up. So there's often opportunities for like academic engagement with research once you are also a practicing physician. We'll go to the next slide, please. Okay, so if you aren't super keen on research, which is totally okay, there are other things that you should think about or can think about on your pathways to medicine. So lots of times people will do a master's degree because they didn't get into medicine the first time. Like you all know, like it is super competitive. And so lots of people apply to medical school multiple times before they're accepted, or they apply multiple times and then they do something else and they realize that they love that and that sometimes that medicine isn't the path that they want to do. And that's totally okay. So sometimes instead of doing a master's degree, it might benefit you to like just take a gap year. And people often call them like gap years before you get into medicine, but it's also just like live your life before you get into medicine. So doing things like gaining work experience, gaining life experience, like sometimes people will travel for a little while. Sometimes they like focus on a different type of career than they might have had before, that kind of thing. There are lots of different things. Don't do a master's degree just for the sake of doing a master's degree. Like you should pick something that you're interested in doing that can help you if you don't get into medicine in other ways. So like don't do a physio degree if you don't want to be a physiotherapist, or just do it to get into med school. Lots of times medicine is a second or like third career for people. There are tons of people in my class who worked as nurses and teachers and like accountants, engineers before they came to medical school. And so it's totally okay to do something else first and then to like find your way back or find your way to medicine. And it is like, I'm not going to sugarcoat it. It's a challenging process, right? So there are many ways to get there. And I know that we all want to be like just quick on track to get there, but there are lots of other things. We'll go to the next slide, please. Okay, so some things to consider about the traditional path. So this is the like medicine or undergrad, medicine, direct, not a lot of time off in between. Some of the pros are that you definitely get an earlier start in medicine. There's a lot of training required to become a physician, right? So like most people aren't going to be done their medical school until they're like 26 would be the very, very earliest that you can pretty much be done medical school. Um, in some cases, it's a little earlier depending on your circumstances, but like 26 is like the youngest, typically speaking, that you would be when you're finishing medicine. Um, and so that's like you, at that point, your peers who have just done an undergraduate degree, who have started working right out of school, are like 5 years into their careers, right? And you're just starting yours. So starting as early as possible is definitely nice because it is like a career that you want for a while. Yeah. You definitely will have a lot of time to work in that career. And so that's something that's nice. But something to consider is that you have less time to explore other options and just like different things that you're interested in life. And it definitely is like a financial burden because you don't have money going into medical school, and medical school is expensive. So we'll go there. And we'll go to the next slide. Thank you. Some of the advantages of doing a non-traditional path, so like having some time between your undergrad and medical school or doing a master's, doing a PhD, whatnot, is that you have a super expanded skill set. If you have done something different before coming to med school, then you've got a different skill than everyone else in your class. You also have just more perspective on the healthcare system and the world, and you get to confirm that medicine is what you really want to do. Some of the cons are that it's hard to go back to school after being established in a career or in something else. And so it's strenuous training that can be difficult, like momentum to pick up if you've been out of school for a little while. It's also, like I said, like it's a long time to be training. And so that's just something to think about later on. And we'll go next. Okay, so like I alluded to, I think this is one of my last slides. There are options to be doing research at the same time as you're in medical school. In Canada, there are most schools will offer MD, PhD programs. So that's when you do concurrent medical degree and PhD. So you've got that clinician researcher alignment right from the get-go. It's typically like a 7 to 9 year program. And it's broken up differently at different schools, but that is definitely an option. So something to think about. And I don't know of any MD and master programs in Canada, but definitely in the States, there are lots of programs where you can do like a master's degree and like a master's of public health or a master's of global health, a master's of business administration kind of things while you're also in medical school. And sometimes there are different ways to do a master's degree, like in residency, where you're supported to do that, or like in between your medical degree. Um, yeah. Okay, so this is my last slide. I just want to emphasize that there are lots of pathways to medicine. I talked about some of the different research opportunities at all stages of like medical and pre-medical training. Um, and I really want to emphasize just like be kind and be curious. And that's like the most important thing for people going into medicine. It is quite a journey and it looks different for everyone. Um, I know we're kind of short on time. So if anyone has questions, like feel free to send me an email anytime. My email listed there is the best way to reach me. And we have some questions in the chat um, that I can look at now.
Yep.
Yeah, go ahead.
So thank you so much, Kate. We have, if I can actually get the link, we are just going to ask everyone does the attendance while we go through the questions. The link will be up for about, there we go. The link will be up for about 1 hour after the webinar for you to fill it out, after which we will close it again. Um, yep, here. I'll put it in the chat. And while we wait for everyone to fill out their attendance, we will go ahead and answer some of the questions. But if you don't get to your question, don't worry. In the Discord space, we'll open up a temporary channel for the webinar for you to put down your questions, just so that it's all nice and organized. Everyone can see all everyone's questions, and maybe everyone can gain some extra knowledge about other people's questions. I will read them out from the chat just to make it easier. So they are asking for, okay. So if I do an MD PhD program, do I graduate with both an MD and a PhD, or would it just be skipping over to an MD?
Yep. So if you do an MD PhD program, you get an MD and a PhD at the same time. Yeah. So the advantage to that is that you're both a researcher and a clinician when you finish. And so you can do lots of like clinical research at the same time.
Can you get your master's during your undergraduate?
No, so you have to do an undergraduate degree before you start your master's degree. So it's like a successive kind of program. You have to apply for a master's degree when you're done your undergrad. You can definitely like roll into a master's, is what it's called sometimes, specifically if you've done an undergraduate thesis. So sometimes like the work that you did in your undergrad as a research assistant or like with a researcher, so a prof, sometimes they'll invite you back to their lab and say, like, we'd like you to continue the research that you've been doing as a master's student. And so then you get a second degree. The master's is a separate degree. And a master's degree is like a higher level than an undergraduate degree.
And how does that work and how much time out of the 4 years goes into it? So I guess they're wondering about the timing there.
Yeah, so your undergrad would take the 4 years typically to do, and then a master's is often like between 1 and 3 years after your undergrad. So to get an undergrad and a master's degree is somewhere between like 5 and 7 years.
Yep. And then they also asked, just to confirm, a thesis-based project usually takes an ex honors is when you do a thesis-based project, which usually takes an extra year.
Yeah, so sometimes it takes an extra year. It doesn't always, like it really depends on the program. Sometimes you can do it in 4 years, and sometimes they ask that you do it in five.
Yeah, okay, so someone is in the sixth form and they want to know what would help their college application as their school does not provide an EPQ, and how do they get started on making a research paper? I'm not sure
Okay,
if
so
you, yeah, do you
yeah,
know
I
what an
don't
EPQ
know
is?
about like providing an EPQ. Um,
Yeah.
if
If
anyone in Canada,
Jessica, if you want to expand on that in the chat,
yeah,
we
or
can
yeah,
definitely.
if you want to send me an email or put it in the Discord, that's great too. And then getting started on making a research paper, you can definitely reach out to some profs, see if there's anyone in your community or like if there's a university nearby you that's interested in taking high school students. You don't need to make a research paper in high school, but that's some of the places to start is to send emails, maybe use LinkedIn, reach out to some researchers and see if anyone is looking for help.
Yep. Okay. Thank you everybody for attending today. Please make sure you fill out the attendance link and we will open up the channel in the Discord for questions. This meeting will now be ending, so if you would like to leave once you've filled out the attendance, feel free to.
Thanks, everybody. Take care.